Hello everyone, karibuni sana. This is Dr. Swabra Swale
and Dr. Majala
from Genecology Kenya.
And I'm Dr. Hilda Nabiswa, Diabetes Dr. KE.
Finally, it has happened. We have sat together, the diabetes and the gynetics, the fine girls. Karibu sana, Dr.
Thank you.
I thought maybe we should share this platform to talk about diabetes and how it affects our pregnant women. So maybe just tell us, what do you do in Diabetes Dr. Kenya?
So Diabetes Dr. Kenya is an awareness platform. I use it to educate people about diabetes because I've realized we are headed in a very wrong direction. 143% rise in diabetes in the next 20 years. Yet nothing is being done.
143.
Yes. And that includes also pregnant women.
Yes.
So that's why I am trying to really reach out to people so that they can know more about diabetes and how to prevent it. Yes.
And so then what is diabetes, Doctor?
So diabetes is a state in the body where sugar levels are higher than normal.
Okay.
Just that.
Now, Dr. Majala, maybe bring it home. What is diabetes then in pregnancy? What exactly puts us at risk as pregnant women?
So at risk just because of the metabolism that goes on in pregnancy.
Okay.
We are pregnant women at an increased risk
of...
I said we. Pregnant women at an increased risk of diabetes. So some of the things that we do early on, pre-pregnancy and then into pregnancy as well, is to counsel our women.
Yeah.
So we try and identify risks that they may have either in previous pregnancies or in the current pregnancy that we put them at risk of diabetes, and then screen accordingly.
Maybe it's also important to know that this woman may already have had diabetes before. And so maybe then, back to you, Dr. Hilda, if a woman already had diabetes, are there any special considerations before she thinks of pregnancy?
Yes, that's a very good question. So first of all, gestational diabetes is different from type 2 diabetes. You can be someone who had a type 2 diabetes then got pregnant. That is not gestational diabetes. Gestational diabetes is when you get diabetes because of the pregnancy. And usually that one, after the pregnancy is out, the diabetes
also disappears. That is very important to me.
Yeah.
Because women usually wonder, am I going to have diabetes my whole life?
Medication forever.
I don't know why that's usually an issue. No, this is not forever lasting or long lasting, okay? So then how does a woman who have diabetes in pregnancy, so whether gestational or already type 2, how does she present majorly?
So remember, the signs and symptoms of diabetes are across board, they're the same, which are excessive thirst, excessive hunger, eating a lot, and also peeing a lot because of the excess sugar in the system.
Yes.
However, people who have had diabetes in pregnancy, sometimes the sugar is not that high, but it actually manifests as the size of the baby.
Yes.
So you can find someone whose babies have been big, and no one knew why the reason.
Exactly.
The problem.
No one tested.
No one tested.
Exactly. Yeah.
And so then in obstetrics, I know she had already started on it. How does this woman, in terms of the child, the woman herself, how does she present? Yeah.
Okay, so for women, for the children, a lot of times we see macrosomic babies. A lot of times we see big babies, we see previous history of big babies like you said, and then with the big babies there are complications that occur. So complications in labor in terms of the labor takes longer than expected, or it gets obstructed, gets stuck sort of, and then with obstructed labor she gets complications like adrenal tears and other complications, bleeds heavily after delivery.
Actually, I had a patient once, and all that came out clearly was injury to 2 previous babies in terms of the delivery process. And so then you wonder, why were they injured? Then you tease out the signs, etc., etc. We'll get to the complications. Yeah? How then do we make a diagnosis of diabetes in pregnancy?
So, like we said, diabetes in pregnancy is all about higher sugar than normal. That's it, yeah? So, nowadays we say all pregnant women have to get screened, universal screening, because we are losing a lot of people's diagnosis because sometimes the symptoms are not so
obvious.
They're
very muted.
So there's a 1-step and a 2-step way of checking for it. Generally, I think here we do 1 step in Kenya. So we do something called an OGTT, and we see how the sugars behave to a certain load of glucose that is put in the system. So once you get the glucose in the system, then we check the sugar immediately, then after 1 hour, then after 2 hours. Then we see if the sugar is higher than normal, we say this is diabetes. So there are some set targets that we check, and then we decide whether it's a positive test or a negative test.
Or normal test.
So we've now made the diagnosis, and then I'm sure you do not just make a diagnosis and decide, okay, now we are done, we have diabetes, we treat it. There are tests that we can do follow-up here, so that we keep monitoring, are we on the right track in terms of sugar control? Maybe Dr. Majala, you can elaborate on that a little bit.
So, like she said, once we get a diagnosis, so then now the question is what next? So the what next a lot of times is you check and see where does this woman fall. Is she diet and exercise? Does she fall into the category for diet and exercise control only, or do we need medication? And then always link two people. So we always send the patients to a diabetes specialist, and always send the patients to a dietitian as well. Because we work as a multi-team, but we don't know everything. Yeah. So then, if we decide your sugar's at a certain level high, but not this high, then we manage you with diet and exercise without lifestyle control, basically. And then if your sugars are above another level, then we decide we're starting medications. So usually the medications, the first choice is usually oral medications. If the woman cannot take the oral medication because of whether it's contraindicated or something else, then we may go into insulin together with a diabetes specialist. And then the monitoring is an everyday process. And that's something that women have seen sometimes struggle with. Understandably, it's hard, but you have to check your sugars every day. When you wake up, keep a chart.
And 2 hours after every meal.
Exactly.
If you can do 4 sugars in a day, then that is a perfect.
Maybe tell us more about that. Like, what can she do at home? Now she has a diagnosis, she's on medicines, and she has a machine.
Yes.
So how does she go about it?
So first of all, it's important to remember that insulin resistance, which is how the diabetes comes about, the body is not responding well to insulin. It's also has a lot to do with weight. So remember, at the back of your mind, you want to gain as little weight as possible during pregnancy, but still within the target. Yeah. So if you're an overweight person, for example, you should not gain above 10.5.
So usually we say, usually we say no one will ask you to lose weight in pregnancy, but we may recommend that you gain slightly less. And so if you are already overweight, we're talking about 6 to maximum 10.
Yes.
Keep it at 6.
Yes. So just remember, it's extremely important to know how many kilos are you supposed to gain, because this will go a long way in helping to reduce your complications of diabetes. Then now, if you already have the diabetes, one is ensure that you have your sugar checked. At least, if you can do 4 times a day, that's fine. Some people are not able to. So I usually tell them do at least twice a day. Fasting, which is in the morning, your sugar should not be more than 5.1. So if you can have your sugars ranging between 4 and 5.1, that's where we want it. And then 2 hours after eating, your sugar should not go above 6.7. 2 hours after eating. So just remember, those are the targets we want. Not so much, just that. Yeah.
Thank you, Dr. Hilda, again for coming in.
She should come more.
I know. So thank you for watching, guys. As always, subscribe to our YouTube channel, follow us on Instagram and our other social media sites.
We'll link them
At
below
the
video.
bottom. Yes. And have a lovely, lovely day, guys.
Bye-bye.